This is Dr. James, and how do you tell the difference between a diaper rash that's just from like constantly having pee or poop against it or rubbing versus a yeast infection? And to be honest, sometimes even doctors don't get this right at the first stab. Sometimes we have to try something, and if it doesn't work, then we assume it's the other thing. And this happens all the time in dermatology, where we'll try a steroid, and if that doesn't get worked, then we'll try an antifungal, and if that doesn't get better, then we'll try an antibacterial, because sometimes it's really hard. But a good rule of thumb for yeast is the rash in the diaper area will be bright red and have like a shiny look to it with little red dots around the edges. And those are called satellite lesions. And when we see that, that's your typical yeast infection. And we'll usually prescribe an antifungal. But sometimes it's not that clear cut. Sometimes it's just in the beginning. And in the beginning, well, everything kind of looks the same. So a lot of times we'll start off with just using some diaper rash cream. If that doesn't work, we may use a little bit of hydrocortisone to try and take out the redness and the pain. If that doesn't work, we'll go, okay, this is probably fungal. And then we'll try an antifungal. And then kind of as a last ditch resort, which is actually extremely rare, we think, okay, well, maybe there's a bacterial component to that. Maybe we should do an antibacterial cream. So sometimes, just like you can't tell whether your baby's hungry or mad or hurting all the time, as doctors, sometimes the rash isn't as always clear cut. Now, those ones that are in the pictures in the book, there's always the worst case scenarios. And that's the reason you should never Google things, because the pictures in Googles are always the far extremes. They always look the worst. It's not always that clear cut. So sometimes we may have to take a run and try a couple different things before we even get the right diagnosis. How could we expect you to do that as the parent? It's the reason we're here, is because, well, after you see thousands and thousands and thousands of it, you start to pick up those subtle differences so that you can tell. And as we get older and do this more, we tend to get better at it. Hope that helps.